Sometimes the thing that kills you is hiding in plain sight, not in the places the doctors are taught to search. 20 specialists, everyone a luminary in his or her field, had gathered in a luxury suite to battle a mystery illness, and still the billionaire in the hospital bed slipped further away. Victor Blackwell was fading amid the hum of machines and the worried murmurs of men and women used to solving impossibilities. The room smelled of antiseptic and high-end cologne, a curated sanitization designed to comfort those with money and power. Angela Beaumont moved through that world like a ghost, neat, efficient, unseen, yet her attention was as keen as a scalpel's edge. When she inhaled the air of Victor Blackwell's suite one night, she recognized beneath the clinical scent a metallic note that arrested her chemistry-trained mind. She froze in place. Small physical clues clicked into focus, nails that had turned yellow along characteristic lines, hair slipping away in an odd pattern, a discoloration along the gum line that was faint but telling. Where others saw fragmented symptoms, Angela saw a single thread. The answer snapped into place with the cold clarity of a lab result. A heavy metal, thallium, was systematically poisoning him. The ultra-private wing in Johns Hopkins that housed Blackwell's room was the kind of place where wealth bought discretion and bespoke care. Medical equipment was masked by dark wood panels and warm lighting, so the space resembled a boutique hotel more than a hospital. Blackwell had demanded the best minds the country could offer, and a small army of specialists attended his bedside like a council summoned to solve a crisis. Dr. Thaddeus Reynolds presided over them with the calm certainty of pedigree. Silver hair, a Harvard pedigree, a voice that rarely needed to rise. "We've exhausted conventional avenues," he told his team. "Liver, neurological, renal, the cascade continues. We must think beyond our usual boxes." Angela kept her head low as she dusted the suite, allowing her ears to gather pieces of the conversation she had no right to hear. 15 years earlier, she had been the star of a chemistry department at university. Scholarships, accolades, a future mapped toward medical research. Then a sudden family tragedy yanked her off that path. Responsibilities at home forced her to leave school, promising herself she would return someday. That day never came. Yet the knowledge she had gained did not vanish. It sat with her, quietly alive, accessible when she needed it. She cataloged details as she worked, shifts in item placement, tiny inconsistencies that to others were meaningless. On the bathroom counter, immaculate grooming items were arrayed like offerings. The hand cream, black jar, imported, luxurious, had not been there the day before. When Jefferson Burke, a man known for business rivalry turned public ally, arrived with that same black jar and positioned it precisely where someone would be likely to use it, Angela felt the hairs on the back of her neck rise. The pattern of regular visits, each accompanied by that jar, demonstrated a deliberate placement that looked less like comfort and more like delivery. In the wards, medical staff spoke in the guarded tones of professionals who'd seen too many dead ends. "It's the strangest progression," one resident said. "Reynolds thinks autoimmune." "The panels are inconsistent," another replied. Angela folded these fragments into the growing hypothesis in her head. The symptoms, gastrointestinal distress, ascending peripheral neuropathy, a particular alopecia pattern, were a textbook constellation for thallium toxicity. But thallium doesn't announce itself. It can be odorless, colorless, and introduced slowly enough to masquerade as multiple unrelated conditions. The world's top specialists, she realized with a sting, were not looking for this. When Victor Blackwell's monitors screamed an alarm at 2:17 a.m., Angela was cleaning an adjoining room. The code blue sent a flurry through the quiet corridors. Doctors, nurses, and techs rushed in with rehearsed precision. Blackwell's numbers nosedived. Liver enzymes sky high, kidneys failing, neurological responses muted. The team worked as a single organism, splicing interventions, trying to staunch the decline, yet their faces carried the distress of people being outpaced by the disease. While the crisis ebbed and the room cleared, Angela slipped inside to finish her tidying and to examine whatever remained for clues. She lingered over the hand cream jar. Rubbing a little between her fingers, she observed a faint metallic sheen that, paired with the clinical picture, sent her mind sliding back to a toxicology lecture she'd once absorbed in college. Thallium. Stealthy. Easily absorbed through skin. Devastating when introduced over time. Her heart hammered. She knew what she needed to say, but she also knew the wall she'd have to batter through. She approached Sarah, a night nurse she'd befriended over coffee breaks and quick shared smiles. "Has anyone tested Mr. Blackwell for thallium?" Angela asked, trying to keep her voice quiet and professional. Sarah's warmth stiffened into protocol. "Angela, we appreciate your concern, but this is medical. The specialists are running comprehensive tests." The dismissal felt familiar. Cleaning staff were expected to be seen, not heard. Angela left the room burning with a frustration seasoned by years of being overlooked. At home, she pulled her old textbooks from a guarded corner and read through the heavy metal chapters again, confirming the fit between the man in the bed and the poison she suspected. Thallium's signs were, she found, almost disturbingly on point. Back at work, she watched Jefferson Burke's visits more closely. He arrived as before, smiling, making small talk, placing the black jar where Blackwell or the nursing staff would readily find it. The timing of his visits matched Victor's symptom escalations. Angela weighed her options. She could keep quiet and watch a life erode. Or she could push, risk her job, her income, the fragile stability she had built for her children. In the end, compassion won. Quietly, she devised a plan that hinged on two things: collecting irrefutable proof and presenting it in a way that the doctors could not ignore. She could not demand a lab requisition. She could not barge into the conference and expect to be heeded. She needed evidence in a form that appealed to their training: data, samples, patterns. At a moment when the suite was unobserved, she took a tiny amount of the hand cream and slipped it into a sterile container she'd appropriated from supplies. In a maintenance closet, she improvised a field test drawing on reactions she'd learned in college labs. It was crude by institutional standards, but chemically sound. The makeshift assay produced a distinctive reaction, a precipitate and color shift consistent with thallium ions. She photographed the result on her phone. Then she scoured visitor logs and compiled a timeline of Burke's visits alongside Blackwell's decline, arranging the evidence in a sequence that told a damning story. Pride and terror walked together as she entered the meeting that afternoon, carrying a stack of notes, a visitor log printout, her phone with photos, and her small jar of assay residue. The room, filled with prominent doctors, went still as Dr. Reynolds looked up from his briefing. "This is a closed medical conference," he began, already bristling. Angela ignored the rebuke and set her evidence down on the table. "Victor Blackwell is being poisoned with thallium," she said. The room's reaction was instantaneous: scoffs, a ripple of disbelief, then wary attention as she laid out the arc of symptoms and the correlation with Burke's hand cream deliveries. Angela spoke in calm, practiced explanations: the classic gastrointestinal and neurological progression, the distinctive hair loss that sets thallium apart from other toxic agents, the way chronic low-dose exposure could evade routine screening. She explained the field assay in measured terms, a modified sodium rhodocyanate technique adapted for a resource-poor setting, yet producing a result that should demand lab confirmation. Her voice did not waver even as security opened its mouth and an attending physician began to scoff. She had prepared for contempt. She had not prepared for the silence that followed, the brittle pause as private expertise collided with unexpected evidence. Dr. Park, a younger physician who had earlier dismissed her, leaned forward, curiosity overcoming protocol. If the poisoning was slow and dermal, standard screening might indeed miss the cumulative load, he murmured. Another specialist flipped through the charts Angela had left on the table. The pattern was there if you knew how to read it. Faces that had been blank with irritation minutes before were now mapping her logic, tracing a path from symptom to source. Dr. Reynolds, the image of composure, studied the photographs of the test. For the first time, he asked her a technical question. How had she performed the test? Angela answered without hesitation, naming the reaction and describing the step-by-step logic. There was a ripple of recognition among those who had once studied under the same professors she'd named. The fact that she'd been a student in Professor Harrison's advanced course altered their tone. It gave context to her method and legitimacy to her voice. What had been laughter became an uneasy professional scrutiny as the evidence, however obtained, could no longer be casually dismissed. Queries turned into directives. The specialists demanded precise lab tests, ordered targeted toxicology panels, and called for a security hold on visitor samples. Within hours, the lab confirmed what Angela's improvised test had suggested. Thallium was present. The revelation splayed through the suite like a current. Medical reasoning,